the health care reform debate, and quite simply, it boils down to if the insurance companies win, we lose. Conservative estimates show that health insurance companies like United Healthcare are spending an average of $641,000 a day to oppose reform. Why? Because they profit by keeping the system as it is. They profit from denying our claims. They profit from raising our premiums and co-pays and deductibles whenever they feel like it. And they profit when they deny care because of pre-existing conditions. And they profit when they make our health care detention standards up to our doctors. I spoke to a doctor today, and I said, tell me about United Healthcare. And he said, he's cringed when someone comes in that has United Healthcare insurance. They are late making their payments. They have to fight for everything that they get. So it's not just the consumers, it's the doctors, too. So today we're demanding that the bureaucrats at United Healthcare and the other big for-profit insurance companies stop these practices. We're here because we're sick of big insurance denying our care to maximize their profits. We have Dr. Blackwell with us this afternoon, and he's got a few words for us. Dr. Blackwell?
Are you back holding a sign?
Okay, to me it's very simple. You cannot have effective and substantive health reform in this country without the inclusion of a public option. It's the only way that people who are your average consumers can have affordable, meaningful, and accountable alternatives available to them in the marketplace. A public option would force insurers to respect consumers, moderate costs, and compete more honestly in the workplace and in the marketplace. Public insurance is clearly more efficient. Medicare has proven that it is able to cost less and cover more, as can be seen in every other industrialized nation. And it's pro-choice, if you will. It doesn't yet get rid of the mess that is health insurance in the private sector, but it allows folks to select a preference. And besides, it lowers administrative costs and operates outside the need for profit. It forces private insurers to respond in kind or price themselves out of demand. If there's anything that needs to be done at this time by the government, it is to throw its weight around to ensure quality health care for all of its citizens. Now, many folks have historically conveniently claimed that the government is spendthrift, burdensome, inefficient, wasteful, and get this, can't compete with the private sector. Now they're running scared with the idea that a public option will destroy the corporate insurance system, screaming buzzwords like socialism and Afro-Leninism and to capitalize on our xenophobic ignoramuses that we have in this country. But enough is enough. What business are we about anyway in this country? Are we to care more about corporate interests than we are about what will best serve the masses of people? No! Especially those who can't navigate the private insurance system for lack of funds or arbitrary qualifications or like conditions. Right now, business has not proved that it can serve the people better than the people represented by government. And they're afraid of that challenge. The public option is not meant to replace or get rid of private insurers. It's not insisting on a single payer plan, like it or not. Of course, I like that idea. What it does do is provide a crucial counterposition to private insurance plans that are becoming increasingly consolidated and eliminating real choice. The bottom line is that if we are seeking to provide affordable, quality care to consumers, a public health plan is essential. We have not yet even talked about the unemployed, who obviously cannot rely on an employer largely to assist in the acquisition of health insurance. A public option would not be tied to an employer, and those who find themselves at the bottom of the economic ladder would be able to get the help they need to stand and become more marketable. It seems to me we would rather embrace a broken system that is clearly failing millions upon millions of people, as well as the uninsured, than develop an option that makes affordable, accessible, and quality health care a reality for us all. What other way is there to curb costs and crooks than to have a federally overseen and controlled health care system? Basically, I believe not to have a public option is immoral and a travesty of justice. Let's say the moral fiber of a nation, the probity of a nation, is measured by how the poorest are treated. If we are interested in making the United States a stronger nation, we need to ensure that all of its citizens have affordable, unimpeded access to quality health care.
Yeah.
Health care is one of our basic existential needs, and as such, people should have the right to medical care so that they can continue to be or become regular contributors to the body politic and the entire socio-cultural milieu. I have an especial concern for those who are poor and those who have been perennially locked out of the structures, processes, and policies of our democratic republic. They are the ones who are screaming for a public option, and their voices are not really being heard. As a matter of fact, their lives depend on it, both figuratively and literally. A public option is the only meaningful, ethical, and hospitable way to reform the health system today.
Yeah.
And I close by saying, as long as people hunger, as long as people thirst, and ignorance and illness and warfare do their worst, as long as there's injustice in any of God's lands, we are our neighbor's keeper and dare not wash our hands. God bless you.
Thank you.